Hello, everybody. Good evening in Europe and Hungary, and good afternoon or good morning in America and Canada. I see people starting to join up, and I have a very special guest today. And I would like to introduce to you Attila Tombacz, MD, who's with me here today, and we will discuss hypoxia issues. What is hypoxia? Why it's so important? And we would like to get you a little bit closer to understand if there is a chronic disease and maybe some hypoxic issue behind it, how we can maybe handle it, especially when we get into the part when we have wounds, what is very hard to treat or not even able to treat. We have a solution how we can go with this. And I would like to ask Attila to introduce yourself.
Introduce myself.
Yes.
Okay. So first of all, hi everybody, and thank you for the invitation. I'm really glad to be here, and I hope you will be very satisfied with our conversation and can learn a lot of interesting new things. We organized this meeting to be not so scientific, much more informative, and it's a quite free conversation between us, so it's not a lecture. We'll see some pictures. We prepare a demonstration to show you how can we diagnose and measure the differences between the special waters and the Kaqun water. And at the end, we'll have some time for questions and answers. About myself, I'm a medical doctor. I graduated in '88 in my birth city. I'm Hungarian medical doctor, and first I worked for my university as a surgeon, and after that I went to the pediatric clinic, and I planned to be a pediatric surgeon. And later I went to a pharmaceutical company, actually not one, it was 3 other companies, a German, British, and an American company. And I saw some proof sources, and I thought I look for alternative methods for healing patients. And when I saw Dr. Lyons very first time, I was convinced for the first sight, and it was a good meeting, and it shocked me. The information was very new regarding the Kaqun water and the oxygen therapy. And when I went home, I felt I'm in a good place, in a good time.
I remember in the beginning you were very skeptic.
Absolutely,
on this.
Absolutely. So I had a medical practice in the downtown of Budapest, and I asked Robert to be in the Kaqun spa as a visitor, and I planned to talk to our guests and do many interviews with them. Because I would like to convince myself. I don't believe in brochures and presentations. I do a lot before. So I can convince myself with my eyes, with the data, with the special case studies, and it was outstanding.
Yes, I remember in my end, let me tell you, they told me you are coming.
Yeah.
It's a very famous doctor coming from Szeged. And I said, okay, so we have to really put ourselves showing about Kaqun. And I'll never forget it when you arrived, and I see your attention was focused on it.
The body language.
Yes, the body language. It was very good. You were focusing on it. And I know now you're knowing this water about 3 years now.
Yeah.
And you saw many cases. And as a medical doctor, you've been convinced now we have some kind of a ongoing relief on patients suffering from hypoxic issue. because I would not like to call today, as you said, not a technicus terminus will be the important. It's going to be important for you to recognize what is hypoxic and what is not.
Yeah.
So I think once we're gonna get ready for the presentation, we're gonna able to get on it, and I would like to talk about hypoxia.
Yeah. First of all, we have to determine what is hypoxia. Hypoxia is a Greek expression, and it means the lack of oxygen. The oxygen is our vital element, the basic element of the life. And if the body have not enough oxygen, it always cause a lot of fundamental problems. And we try to explain you this day all the chronic pain, all the inflammation, and every severe disease background.
So when I have a headache,
yes,
chronic headache,
doesn't matter which kind of pain.
Mm-hmm.
So
the back pain too.
The back pain, the migraine, the period pain, if gastrointestinal, if I cut my fingers, all the pain is the consequence of the hypoxia.
Uh-huh. So because many of us wake up in the morning, you don't think about it. Your back is hurt, your leg is hurt, you go to the chiropractor. I have no offense because I go too, but I like to go to the baths laying down in the water and I feel rejuvenated. It's because of it?
Yeah, it is an oxygen problem, and when you start to move and do the exercise morning time, all the muscles are filled up with the oxygen. That's why that the pain is missing, and you feel much more comfortable yourself.
Mm-hmm. What is this hypoxia coming? Can we feel this is coming, or how do you know we are hypoxic? Not just the pain. How somebody who's listening today know they have hypoxic issue or not?
Actually, the body is much more clever than any other doctors. So there's a distribution of the oxygen in the organs, in any kind of tissues, and only one tissue is the biggest thief of the world, is the blood. Mm-hmm. It contains itself very stable. So if anyone clip a special instrument to your finger, it measures the oxygen saturation, which refers only the oxygen content of the blood. And you never know how the blood steals the oxygen from the brain, from the lung, from the muscles, from other organs. And as a Kaqun advisor, we have to know what is the situation in the problematic area, is a disease area, what is the problem in your muscles, in your guts, in your head, and fortunately, we have a lot of instruments to measure this situation.
Mm-hmm. I remember 18 years ago when we started it, all we could say two things. We were referring everybody to Otto Warburg studies,
yes,
or we had looking at the patient eyes and said, "Oh, you look good," and that was the diagnosis of this therapy. So now we are much more farther than that.
Actually, the oxygen saturation in the body is age-related. So when you are a newborn baby, you are full with very high quality water and oxygen, and it's a normal process.
You mean liquid?
Yeah,
liquid. Okay.
When you are getting older and older, that's normal. The liquid content of the body decrease, and the oxygenation of the tissues are less and less and less. Mm-hmm. That's normal. We always have to compare your data to your previous data. So measuring the hypoxia, the lack of oxygen, is always for monitoring.
Mm-hmm.
So that's
monitoring purposes.
That monitoring purposes.
Mm-hmm. Okay, so
you cannot compare your data to my data.
So everybody has to be on their own. Okay, because I made my PhD on this.
Congratulations!
Thank you. Thank you,
Cheer
thank
up.
you, thank you. But what I'm talking about is, I was talking there 18 years of work of doing scientific work on a cellular level, on the mitochondria level, and I understand when somebody getting to the stage where you have hypoxic, chronically hypoxic, you have some kind of a cellular dysfunction.
Absolutely.
So what I experience is when somebody comes to me and say there is a chronic inflammation, when we check that inflammation close to the skin surfaces, and we make the person, let's say, drink the water, in 3 minutes, 4 minutes, we can see the oxygen partial pressure elevate in the tissue. Can you explain to me or to the viewers here why is that?
The trick in the background is the energy level of your body, and we have a cell organ. The name is mitochondria, and it produces the energy. And this process, when the mitochondria converts the food to the energy for the cells, is very oxygen consuming process. If you have not enough oxygen, you can produce much less energy. If you have a normal amount of oxygen in your body, you can produce 16 times more energy.
So
then if you drink the water, which contains a lot of oxygen, it gives you immediate power boost.
I get many times, people ask me, especially doctors, they asking me, this water is not even bubbling, so how could you say this has oxygen in it? So I have no time to show it to everybody how much oxygen in there and what is it, but we can always, compare one to another, let's say normal water or normal filtered water, like I have here, normal filtered water, which means good quality water, but it's nothing like Kaqun water. So it's much higher oxygen and much stable oxygen in there.
Yeah, the way of thinking is what's the difference between the oxygenated waters and the Kaqun water? Oxygenated means anyone use a high pressure and take the oxygen to the water
from an outside source.
From outside source, yes. And if you go to the pharmacy or a mall, you can buy 100 type of oxygenated water, but in my mind it means nothing.
Can you explain to us?
Yeah, because if you leave the oxygenated water on the table, 5 minutes later you cannot find any oxygen in it.
Or not that much, yes.
Not that much, nothing.
It's why, because the pressure,
that's pressure question. The oxygen solubility of the oxygen is 10,000 times less than the carbohydrate. And you know how much pressure is needed to make a soda.
Yes, you need a heavy tank to push the pressure in it.
You would need to use 10,000 times bigger pressure to take the oxygen to the water to have the same concentration. So it's not working. It's for me.
And then as soon as you release it, it comes out, is it?
Absolutely, immediately. And our water, it was a miracle for myself. And I don't know the technical background, because you told me you would kill me if you tell the whole story.
You should not say this.
So actually, I don't know the technical background, but we have a liquid which contains liquid oxygen, and that is the trick. Because the liquid oxygen is we cannot see the oxygen in the Kaqun water. It cannot form bubbles, and if I mix and shake, you cannot see any bubbles in the bottle. and this is the way how can I explain to the others the oxygenated water and the Kaqun water. It's so easy.
It is. One other question comes up to my mind. I know when you're born, you have, I'm talking about parcel pressure of oxygen.
Yes.
So when you're born, you have 96, 97 mercury millimeter, just like blood pressure when you measure, mercury millimeter high pressure in the tissue.
In the tissue.
When you get, that was when you're 2 weeks old. When you get 80 years old, you have maximum 60.
Yeah.
Nothing you can do about that too. So I see some kind of a correlation between the age dependency on how much oxygen stays at the tissue. Is it that?
If you drink this water, you can keep your level 10-15% higher than it would be if I see the age related curve. And if I translate this thing, it gives you 15 more years. Your organs functioning like a man who is 15 years younger than you. So if an old man asks me, an elderly man asks me, why is it important for him or her, I always ask, would you like to be 15 years younger? And the answer, when I explain,
and the answer,
all of them would like.
That's also very interesting because one other subject this is just coming to my mind. People come to me and say, "Oh, I would like to get younger, and I would like to," and I explain to them, it's not one day to another.
Yeah.
Because also
it's
a process. Also, very much critics going on. Especially in the beginning, like 10 years ago, 12 years ago, when the internalist doctors came to me and said, how could you think of it to, one breath, yes. You can have 100 times more oxygen to your cells than just take a sip of this water or take 3 deciliters of this water. And I said, it's very interesting because you're absolutely right, because your lung is capable to bring in lots of oxygen to your lungs, to your cells, but it's not mean is all the cells gonna benefit out of that. But if I drink the water and mixing that liquid with the body liquid, it looks like it stores it and slowly releases it. I never met anybody who can hold their breath for 2 hours, and I never met anybody who can breathe so hard to elevate, let's say, 15 to 20 mercury millimeter high pressure. So I believe to bring the hemoglobin bounded oxygen is a different route than coming through the water in a liquid phase and so coming into the cells.
In the primary school, you can learn about the hemoglobin way the blood carries the oxygen to the organs, and so on and so on.
What would like to show you? I would like to show you a little demonstration, not a demonstration, just a little bit the way how we measure the oxygen. So we would like to show you this, the tap water. We will have a view. This is very interesting moment. We will have tap water in one cup, and I have a device but measuring saturation, and it will show temperature, percentage of the oxygen,
and oxygen concentration,
and oxygen concentration. Also, it will show. We're gonna be able to show you this measurement. So, okay. This is gonna be the water. It's not been opened up yet, but you can open it. Open it, no problem.
It's stable.
Yeah, it's stable. You can open it.
We will not lose any
oxygen. We will open it. We will open it. Just keep it that way. If you would do this with any other water, it would be much more dangerous because it would be the oxygen would disappear from the water itself. So we imagine we drink this water, and we would like to have this liquid somehow come to our liquid, what is inside of our cells, the interstitial water on the between the cells, around the cells. So what we have, please help me with this.
Yeah.
Just put this in this inside.
First of all, we can show them what is the air oxygen pressure.
Let's see. So I'm going to turn on the device, and then we will show. First, we're going to show the air. What do we have in the air? It's about 793, very high. Actually, of course, because there's a lot of oxygen in here, and that is a 7.93 milligram per liter. So let's put into there.
You have to know something about this tap water. This is not a regular tap water because there is a filtered one, and we can measure how much is the tap water.
Okay, we're going to put this in here, and you will see decreasing of the oxygen. It's normal. It has to be decreasing. It's going down. And meanwhile, when you do this, I would like to have put some Kaqun water into the Kaqun water.
Yes.
Please. About almost the same amount. That's good. Good. Excellent. And then we will see it's still going down, heading down. Normally the water is about 3.2 and 3.9 between that, and this is a filter water, so this is a little bit higher. But what is important to know, there is no bubbles on the tap water and there is no bubbles in the Kaqun water. So if we did not write it down, we would not know the difference of it. So what I can show you right now is pretty soon the measurement is over. It's 5.24, still going down. 22, 23, and then
I'm pretty sure it would be less than 5.
Yes, it will go down. Okay, put it into the Kaqun, put it in there. Yes, and let's see what's going to happen. It has to elevate. Remember, it was 7.9 was the highest. Now it's already 10.36, so it's elevating rapidly. So the only difference between this
3 times more than the tap water.
Yes, it's
right
almost yes, it's going up, and we can see how it goes. And so can you imagine what would happen if let's say I would put tap water to this middle one like this. We're gonna wait until this goes up. Let's see how far it goes. Oh, it's already 13. It's already 3 times higher. It's going up. And by now, by percentage, is 167%. So that's very high.
Very high.
Now, if you swallow something like this, and let's say this is tap water, and I put it together, this tap water. Okay, it's almost 15. It's still going up. 50. 49, 51. So I would like to put this back in here and have wash them here. We're going to see this going down. Again, we have to do this measurement. Why? Because we want to see the difference between this water and this water. But I tell you what would happen if we think this water, this tap water, is our body liquid.
It's representing
our body liquid. What would happen with us
if
we drink this water? So it's again getting close to 5. We're gonna see this when it jumps to 5. We're not gonna wait too long because we know how far it goes. And let's say in 14 days, we can elevate our oxygen level if we drink the water 5 times a day for 14 days. I mix this water 50%, and we have to see the numbers. As you see, it starts to elevate already that fast. this is so fast. So when somebody drinks the water, it's not a magic why the oxygen partial pressure of the tissue elevates
So fast.
so fast. And the good thing about this, it stays that way. So if I make sternum up a little bit, then it's not mean you have to mix this water to any other water. It's not mean, because when you just drink this water, you have much more effect, as we saw that on the beginning, but it's already going up to 11. So 50% of water almost putting back the same oxygen partial pressure, but definitely much higher than 7.9. So this is absolutely proving how the oxygen gets to the cell. I hope you were watching this, and I hope you were seeing that. I love this presentation because it always proves the quality of the water
And very simple,
and the stability.
very simple and convincing.
Yes. Now you can drink it.
You can.
Thank you. Okay. So let's back. So we saw this.
So if you drink the Kaqun water, it gives you a kind of inventory of oxygen. And the human being have to breathe during the life. Exhale, inhale, exhale, inhale. You cannot change. And unfortunately, we have no oxygen inventory in the body. And if you drink the Kaqun water, it increases the oxygen level in any tissues and gives you...
Any tissues, organs too?
Any tissues. It's question of time, and the body redistribute the drank oxygen and gives to the organs what needed much more than the others. If you have a big problem in your head, maybe your migraine, the brain will ask a bit more oxygen than the guts. Okay. So not the doctors, the human body will control how can we redistribute the oxygen in the body.
So this explains how we can bring oxygen to the tissue. And so let's say I drink this for 30 days, 40 days, 60 days. How long I can drink that?
If you drink only one glass, it means a lot. If you drink irregularly, it has meaning for your body. But our recommendation to drink day by day, and your daily fluid intake is from your body weight. If you are 100 kilo, or how much is in
220
220 pounds, the half of your daily fluid intake would be from Kaqun water, and the other part from tap water, from soup, for drink, for
juices.
Glass, juices, so
any other water.
Any other one.
As we see, it lives very well with any other. I tried to use this with the protein shake.
Yep.
And I was amazing how the oxygen partial pressure of the protein shake was. That's why bodybuilders love them so much. It is very interesting. Anything what is liquid, we can go. So what I want to get you some of the patients what we had, and I would like to show you a very interesting hypoxic case. It was a case study, and I would like to show different part of it. I would like to show some bacterial, some viral, some fungal, okay, maybe some burns, to see, because I believe it's all very interestingly a hypoxic issue. And now we know about hypoxia. What is hypoxia?
So we choose some case studies, which is very good for demonstration. This is the definition of hypoxia. You can see it. So it's a lack of oxygen, and in any kind of tissues you can have hypoxia. If you have an inflammation, it's hypoxia. If you had a physical training, the muscles are full with lactic acid, and
I measured but
hypoxia.
they were very hypoxic. They were healthy, but they were very hypoxic.
Yeah, after the workout, they are
because of the lactic acid accumulation.
The lactic acid, yes. So I told you about the physical energy. If you drink the Kaqun water, it gives you oxygen, and the oxygen is the basic element of the normal energy production of the cells. So if you have not enough oxygen, you have a lack of physical energy. The cognitive speed and the mental clarity. We have a human clinical trial, and we could prove how effective.
I think it was a double-blind study.
The double-blind study, and it was tailored by the Hungarian Scientific Academy. So there were some elderly patients and some specialists, psychologists and psychiatrists measured the cognitive speed of these elderly patients, and we had outstanding results.
Yes,
so
it was significant. Yes.
If you care about your old parents, this water is fantastic to maintain them in a very good state. So reproduction and endocrine health. Endocrine system is very complex. As if you change one factor, for example, the thyroid hormones, it will affect all of the other endocrine glands. So you can be very sharp with any kind of drugs or other chemical entities, because if you change anything in the endocrine system, it will affect all the other organs.
Like let's say if you take
I give you
birth control pill,
yes,
and somehow affecting your thyroid, it could work into the pancreas also.
Absolutely good example. The corticosteroids is one of the most frequent drug of the world. Is very similar to the hormones of the females and the males, the testosterone and the female hormones. And if you give the corticosteroids, you always disturb all the endocrine system. So with using the Kaqun water can keep balance all the endocrine organs.
Okay. What about tissue
repair? We will have some very good case studies to show you how the oxygen influenced the wound healing capacity, the ability, and we'll see no chance to have a complete healing without oxygen. And vulnerability to chronic diseases. We have a number. The patients in the whole world have chronic disease in 50%. So 50% of the people have any kind of chronic disease.
Kind of, yes.
And I'm pediatrician, and for me it was very bad news. In the age under 10 years, there are a lot of chronic diseases. So when you think the chronic disease is the disease of the elderly people, you are not right. So the common features of the chronic diseases, again, the lack of energy, chronic inflammation,
cellular hypoxia.
Yes, I told you.
And mitochondrial dysfunction, epigenetic changes.
Yes, Dr. Professor Metastasis explained in the previous.
Last week he was here.
That there are epigenetic changes, as we can prove our statements.
Yes, definitely. Okay, so let's go. So what is
So
this?
this is the simple wound. The surgeons say is a tidy wound. Tidy wound means there is a single cut, parallel wound edges, and very easy to heal up. No inflammation, like an ambulance, and you will see a complete recovery. Maybe you can see a pale scar after this, but nothing more. That's a normal wound healing. So after bleeding, it performs a clot, and later on a scab, and finally only the very narrow pale line. So that's the normal.
So that's a normal one.
That's a normal.
And that's the way they heal.
Yes.
If there is circulation, there is blood, oxygen carries there.
There are a lot of need for the normal wound healing, and some factors are inhibitors of the normal wound healing, like the starving, like the smoking, like the hypothermia, so the low temperature, some drugs, and many other things. The hypoxia is the main factor which can...
If that surrounding tissue
Yes,
would be hypoxic.
definitely.
But then, can this be healed if it's hypoxic, constantly hypoxic around it?
Yes, during the process of healing, the oxygen content of this region will be getting normal, and finally it's absolutely okay.
Okay, so let me show you my next one. This lady was 30 years old, and when she came first time to our office, wanted to know what we can do with this infection. I deliberately not telling you what kind of the infection is that. I just tell you this is a viral infection.
Yeah, the name is lichen planus. It's a dermatologic disorder, and sometimes you can see on the skin or the oral cavity, and the doctors don't know what is the cause of the disease. There are two major hypotheses. One is the viral infection, and the other one is the supersensitivity to a chemical thing, like the composite filling in the teeth, or the amalgam. And there is no way how can we treat this kind of disease. So when I saw this lichen planus very first time, I have no clue what can I do with it. With corticosteroids, which is recommended, you can reach some results, but sometimes it will cause other problems. So the side effects of the corticosteroids sometimes bigger than the benefits of using this drug. So when I saw this kind of disease, I thought this is hypoxia, because I told you all of inflammation are hypoxic, and this is an inflammation.
Okay, so why deliberately I'm not wanting to say what kind of disease it is. Thank you very much giving us the input on this. The reason I did not want to say, because the next couple of pictures gonna be all have their technicus terminus.
Yes.
But I don't want people think that way. I want to think that this is hypoxia. Don't look the disease. We know this is a viral caused. That's what we get from the medical report. It's virus causing it. No way to get back. The body can treat this in about 6 months at a time. 5 months could be cured. But this patient has no time, let's say for 6 months. So
because it's itching and painful,
and
exactly. needs some support.
So what I did, I started to measure this patient, Please see the next picture. And what I did, I see specifically again hypoxic skin surface.
Yes.
If you put the sonda on the red part, you will find 62 mercury millimeter high oxygen parcel pressure of the tissue. And if you look at the normal tissue at the belly, it was the same time. This is the same time measurement.
You can compare. It's
You
much
can
less.
compare. It's much less. So we can prove it. Actually, there is a inflammation. So after 30 days, sinking in this water 50 minutes, 2 times, 3 times a day, drinking 1.5 liters of this water, after the first week, she had no itching, no pain, no burns, but things start to dry off. You can see some white powders when she came to me, put it on it, but that's really not solving her problem. It was itching anyway, and it was very painful. Now let's see the next picture. After the therapy, you can see the oxygen parcel pressure was 82 mercury millimeter,
Which is normal.
which is mean absolute for her age. She was 30 years old, so
Yeah.
it's a absolutely normal surface.
It's amazing.
The great thing about this, she never complained again since that. Anytime she has a small red spot showing anywhere in the body,
The problem
jumps
with
in
the
the water.
lichen planus, it's very often recurs.
yes,
And if you get...
and comes back with a venge. Yes,
Yes.
avenger.
So if you are a wise grandmother or a non-medically educated people and see this picture on the back or the abdomen, you can say, okay, it's an inflammation. That's true.
Yeah.
The first medication, the first therapy, not medication, the first therapy could be the oxygen therapy.
Then we made some study separate from this because we wanted to know if anything happens in cellular level. So we get into the cellular immune system. Now we know the genetics is changing
Of
also.
course.
Now we're seeing this and we said, oh my God, we have something here because we see the natural killer cells, the B cells, the T cells, they start to get activated. And it looks to me, the person recovers very fast because of the cellular immune system too, not just the surface. It's because internally changing and cellular wise changing. And of course, the pulse pressure of oxygen is changing. So that's the easiest way to explain it. Let me show you what happened in the back side. We saw that before. It was 62 and 82. And then we see the other surface when it get healed. You can see as happened in the same time. She wake up in the morning and she thought she was in a magic field because all of a sudden just changed everything back to normal. So let's see the next one. That's the normal way. This is in 30 days.
30 days comparing the 6 months.
Compared to 6 months, less pain, less all of those. So let's continue. So what is this if it's not quality of life?
Yeah, it is.
It's not the healing part of it, just the quality of life.
That's important for us because sometimes we are not able to heal diseases. But if we can change the quality of life to a much better condition, we do our best. May I say the Benjamin Franklin words? Benjamin, maybe you know Benjamin Franklin
yes.
was the American statesman and scientist, and he told only God heals, and the doctors can take the fees. And okay, maybe
No, it's maybe a little bit over.
we can do a bit more.
Yes.
But the most important, if I can prove the quality of life, absolutely the most important thing.
Okay, so let's see. Chrissy is writing me and says, show me open wounds. So let me show
This
Chrissy.
is an open wound.
Yes.
And
What do you think about that? What is wrong with this picture?
This is an ulcer.
It's hypoxic?
Yeah, it is definitely. And for me, the confusing how bad is the circulation around the ulcer. You can see quite
like necrotized the veins.
The veins and too dark, and it's not normal. I think this is not an inflammation. It could be a circulation problem, a very fundamental circulation problem,
and inflammation. Around that is inflammation.
Yeah,
maybe.
but the primarily it was circulation problem, and later on the bad circulation caused this kind of ulcer.
Also, this patient was not diabetic.
This kind of ulcer cannot heal up because if the blood cannot transfer enough oxygen to this part, it's not able to heal up.
It started with a small spot, and
getting bigger and
bigger. And what happened is the surgeon always cut it a little bit tighter and tighter, but eventually he said he cannot do too much about this if it gets too much bigger.
Yeah, that's the maximum what a surgeon can do. And you mentioned, and I mentioned to the audience, there is an alternative way how can we transport oxygen to those body parts which has not very good microcirculation. In this situation, the Kaqun water could be a miracle, could be the only chance for these people, because they can get oxygen by the extracellular fluid and not by the circulation, the normal circulation.
Okay, so let's see what's happened in the midway when we changing this. This was using the water. The water was the delivery system, as you said. Yes. And what happened is, in the same position, we tried to get some kind of a results. First, the wound healed up by filling up the wound and make a pink crust around it showed more circulation. But again, we look at the veins condition,
the veins.
Much better condition.
Yeah, in this picture, I cannot see a dramatic improvement of the ulcer, but the veins are in a much better condition.
Okay. Yeah, it is. So I saw the patient personally, so I know first time I could put my finger in the wound. I did too, because I wanted to touch it. And this time it's already level almost with the skin, because that's what's happening. The tissue fills up. Not get infected, but it fills up. And then after that went into a recovery.
Yeah, it's a recovery.
But as you can see, the hypoxic issue was gone. The mercury millimeter jumped up to normal for his age. It was 75 mercury millimeter, and there was a normoxic environment.
And if you see the veins, the picture of the veins are normal, absolutely normal.
So he could go back to work again. It was and
fantastic.
And really was a good result for them. And we see these hypoxic and normoxic issues all the time. And I want to show you another one that's also very interesting. That's also caused by a pathogen. Let's go back to the first picture of this, if we have it. Yes, one more. Yes. Okay, that's the first one. So that was the first picture. That was a 24-year-old male patient coming from Italy. It was mistreated. It's a systematic mycosis. It's nothing else but fungal infection, but treated in the wrong way. And it was actually looks like somebody laying down in a riverbed for 30 days.
Yeah, like a corpse.
Yeah, like a corpse. You get him out of it. And she was only 24. Only luck he had, the girlfriend was Hungarian, who knew about this therapy. So they bring them here, and we had a very good, actually, I would not even call it therapy, Actually, we make them have a spa, lay down in the water, drink the water, lay down in the water, drink the water, and don't eat sugar. That was our advice on this. And look at what happened. After a short while, look at the color. Everything is changing.
How much time?
No, this is about maybe 3 weeks, not months. It's about 3 weeks.
Unbelievable.
It's three weeks, not long time. And then all of a sudden he started to change the color of the nail, plus the skin, the dead skin, the fungal manifested skin just start to drop. Now you can see only the toe, but the whole leg was look like this all the way to the buttocks. And that's why getting dangerous, because it was coming up higher and higher.
So I told you how much inhibitors are in the normal wound healing, and the necrotizing tissues are one of the most important. If you can see the necrotizing tissues, it's always stops the healing. You have to remove it. In that case, the Kaqun therapy was effective because this man lost this dead tissue, and after that he can restart the system. Yes, and the skin tissue has stem cells, and these stem cells know the work. Yeah, of course.
So let's see what happened with it after 3 months, actually. But it became beautiful. It was not more swollen.
This is my leg. It's fake.
No.
Okay.
This is the same guy. You can see the form of the feet. Of course, was much more puffy and different color. But again, if you look at it, the oxygen pulse pressure went up, and that was causing the total recovery. It took us 3 months actually to get to this point. But the good news about that, until that he was using prednisone medications and all kinds of antimycotics, did not work. And what we did, we make him drink the water, have a diet, not taking sugar at all, not any others. We told them he can eat fruit, not a strict Candida diet. We just put it into a normal, no sugar diet.
Did he get any antimycotic?
No, not on these 3 months, no. He could not, because his liver enzymes was really high from the previous medication inserts. So that, I think it was a very interesting normoxic and hypoxic issue. But again, there's a lot of practitioners listening now. I'm sure they see something like this before. I think they know now what to do to eliminate this. Okay, and then that's also very interesting. We had a study at the National Institute of Oncology Hospital in Budapest, and we have a melanoma malignum stage 4 cancer patients human trial study with ethical medical license with the water. And this study was interesting because there was the last 5 months of the patient life, and this is one of them who had this irradiation.
This is a burning.
It's an irradiation burn.
Yeah.
And you should know about this burning, and everybody I'm sure but should know about it. This burning is not like a fire burn. This burn is go through the tissues, and sometimes burns them so much they cannot swallow. Yeah. So the tissue get burned in there. And look at how low is the oxygen pulse pressure. 30. So it's a very deep tissue burn. So usually they need between 6 weeks to 8 weeks to recover, something like this. By then, they cannot continue the radiation therapy because it's too late.
Actually, the most important for me, if you use this kind of irradiation, the radiotherapist focusing it to the cancer, which is deeply under the skin tissue, and they burn the surface, they burn the muscles, they burn the larynx, they burn the esophagus, and everything. So that's why
it's hard to swallow.
Yeah, that's why the lady couldn't swallow and speak.
Yes. So let's see what happened with her. In about 7 days.
7 days.
7 days we get this. She's drinking the water, taking the baths, going under the water. Plus, we have a oxygenated gel, Kaqun gel, and she put 2-3 times a day on that surface. But of course, the doctor said no more radiation until this heals up. But they knew it's not going to heal up.
Just for your better understanding, it was 7 days, but normally it would need 7 weeks.
Yes.
So
Suffering. There's huge difference between one another. So let's see what happened after 10 days, because it's very worth it to see. After 10 days, because of her old age and her condition, she was, never forget, she had a lung cancer, and we were worried about the cancer going up through the lymph nodes to the brain.
To the brain.
And the normoxic condition came back. The good news about this lady, she could go back and do the radiation, so she could live much longer and much better quality of life. She never stopped taking the water and taking the baths after that.
Great.
The whole family, yes. So this is a real hypoxic issue. Lots of inflammation, very quickly reduced inflammation. Okay, let's go a little bit more. And I think we get to this point where we are ready to
answer
some questions. And if you have any left, yes, and then we will see. We will see the questions.
Please put your questions.
Okay. Okay. The question. My question is, if you have poor circulation and amputation, loss of toes.
Yes.
Yes.
Definitely yes.
Yes. Other than taking the water, is there anything else you can advise for a woman, her 80 years old? Now, for 80 years old, to drinking the water, it is very good, but the baths is the key elements. This person should be in the water before the amputation. I don't know if it was a diabetic patient or not, but as remember, older you get, lower your tissue oxygenation. No matter what you do, no matter what kind of herb you take, what kind of medication you take, the underlying problem is hypoxia. Long as the hypoxia is not treated, then it's very hard to treat. I understand if anything else to do, yes, to take care of the foundation of it. And when the foundation is right, you can take any medication, any supplements, any vitamins, what your doctor or naturopath will tell you to use. So I believe I think is answering, but definitely, because older you get, the circulation gets worse and worse. But that's why I believe I've been doing these baths for 20 years, drinking the water for 20 years, and I could not think of it living in another way. I don't know how long I'm going to live, but for long as I live, I want to be strong and healthy. And I know it sounds crazy, but I pushed back my time 30 years. In a 20 years period of time, my biological age is 38 years old.
Nice.
So that's what it is. Okay, what else? Okay, so Attila, can you answer to this maybe?
What is the best treatment for patients with breast cancer that metastasis and did radiation in the spine? There was
okay, first, this is hypoxic or not?
It is absolutely hypoxia. So
don't talk about cancer, talk about hypoxia.
Yeah, for us, the most important, if a new patient is coming, to explain, this is hypoxia. We couldn't heal up any cancer because this is not our job. But if the patient and you in the audience can understand all of cancers are hypoxic, we can improve the hypoxia, and the aftermath of this treatment will be the healing. So in that case, I lost my mother with breast cancer 20 years ago. And this is a mission for me. So it's a very good question. Thank you for this. And with this oxygen water and oxygen spa, we can prove the condition. And many times the clinician says it was a spontaneous regression.
Yeah,
they couldn't understand how can it happen then a cancer is missing from the body. But we saw many times.
Okay, so there is some questions more. Nice coming in, more people asking. Let's get just for the first one, when 39 years old, should have an oncologist to see if it's a hormone-dependent tumor or a mamma carcinoma, or what kind of the tumor is that, and then work together with chemo or radiation therapy. You will get much better results, much faster, and you can get out of it much faster. If you don't go to the traditional way and you're just going to the homeopathic way or natural way, that's also an option, but it's all belong to you to understand and do it. But I strongly recommend to you. In 2.5 years, I work in a hospital with the melanoma patients, as I said. We had excellent results with both together, not separately, but both together.
Both together.
The oncology study came out. It was a human trial study, and they said, Kaqun water could be a supportive therapy for oncology treatment.
Yeah.
Okay, so please think about that. At locally now, we have several beds in the United States. We have Los Angeles, we have Las Vegas, we have in Italy. We have, at the moment, we don't have it in England, but we're working on it. So soon we're going to open up some beds close to London, and we would like to have, or inside London, and we would like to have, some people who are interesting to, to try this out, to come to Hungary, and maybe would like to bring the technology there. We are welcome to that also. Yes, the other one is coming to the clinic in Hungary. Right now it's very difficult because of the pandemic. Before, we had lots of people coming from England, from Germany, from Switzerland, from all over the world, from United States, from China,
Scandinavian
countries, people coming all the time. I hope soon we have all the people coming back, because it looks like we don't have no more hypoxic patients in the world, only COVID patients, which has been also hypoxic. So that's also very interesting for the immune system, but maybe some other time we talk about it. So you can come and, you can come to join up with us. You have all the information on Kaqun.eu. You can find everything on that. Kaqun.eu, you find all the information on that. And you can't travel 80 plus because of open wound.
The first question, as drinking water and the spa water is not the same. But if you have only chance to have drinking water and you have a wound on the forearm, it could be a solution, but it's not the best way.
Okay, when you're 80 years old, and your wound need to be treated, and I know you go to Risilo. I know this place. I love that place, and supporting you from Chrissy. Chrissy is my dear friend of mine. I would like to tell you the water is good, but find a place where you have a hyperbaric chamber and try to get some support on this wound with hyperbaric chamber, because FDA approved that in United States hyperbaric chamber for wound healing also has a properties. A little bit more expensive, but if it's no other choice, I would really recommend that to do that. Okay, hypertension, ensure optimal tissue diffusion, oxygen tissue.
Yeah, that's the same question.
Yes, I know.
That was written.
Water for the improved oxygen. Yes, I have been also drinking normal water, carbonate. Yes, CO2 in my body, improve oxygen exchange. Could carbonate Kaqun water? Would this? Oh, this is Michael. Okay, so we did answer to him this. What I will tell you again. You cannot mix the two together, because once you put carbonated water inside the Kaqun water, it will lower the oxygen partial pressure. Not much, but it will. So the structure will change. You can drink Kaqun water and then wait a little bit and drink the carbonated water. That would be better.
We missed one of question regarding labyrinthitis of the ear. So this is an inflammation, and as we told, all the inflammation are hypoxic. So we can help, we can improve the quality of life of this patient. You have to know the dizziness and some balance problem can fönnmaradhat, azt hogy mondják? Robi, hogy visszamaradhat.
Oh, it stays condition.
It stays, but the inflammation itself can be solved by the Kaqun water.
Yes, it's awesome because of the property of storing the oxygen and not letting the hypoxia develop. So there's no inflammation.
But the inflammation sometimes destroys the very, very fine hair in the inner ear. So the dizziness stays very often.
Okay, and we get a picture here, you know, on the patient leg. This is diabetic patient, or we don't know. We just get the picture.
From Catherine, the French partner.
Oh, from Catherine. Okay, this is severe hypoxia, most likely diabetic ulcers, and you know, and this is need to be addressed, need to be showed. Anything on this else? Show that at the end and asking Robert. Yes.
The final question is from Aniko.
Yes.
And she mentioned this.
It needs to be treated. This one. Drink the water.
Okay.
Use the gel.
So this is a case, and the diabetic patient can drink the water, the Kaqun drops and the bath can help to the patient. The only problem is the liver transplantation. If this patient cannot take any pills avoiding the rejection of the liver, he can have the Kaqun bath. When a patient has a medication against the rejection of the organ, we never recommend the Kaqun bath. This is the only limitation of this technology.
Mm-hmm. And Kaqun drops?
Kaqun drops is no problem because probiotics and will keep the balance of the microbiotics in the guts. So it's highly recommended for this patient.
But I believe not just the guts, but eventually microbiomes all over. So what you have in your guts, you have in your brain.
The question is always, we are living together with the microbiomes, or the microbiome is living together with us?
Yes, I think they are more than us.
Much more.
Because cells is 80 trillion cells, I think. This is 100 times more.
Yes.
So I think we are occupying them as a tissue.
So we recommend the Kaqun drops, and if this elderly man cannot take medication against the rejection of the liver, he can have the Kaqun bath too.
Okay, the Kaqun treats effects on tinnitus?
Could be, it depends on the tinnitus is always the consequence of an former inflammation, and if the inflammation destroyed that very fine hairs inside the inner ear, yes. We couldn't jósolni.
Well, we can project.
We cannot project.
We cannot project.
So
what's coming out.
I recommend to try. And
definitely, but trying means not one time to drink the water.
Yes.
Drink it. Don't go under the water, but drink the water, and see what's happening, because many things is changing. Now we are running into many questions about different diseases, but without due respect, I wanted to come up with an idea today to just show what kind of the hypoxic issues is there. But again, in the end of the day, we only can change hypoxia into normoxia.
Yes.
So
that's our job.
This is our job. Okay. So I thank you very much for coming today, really, and I hope we're gonna get into this more, because I have about 1,000 more pictures to show you. I hope I don't make your day bad or something, but you always must think of it. This could change medicine in the way it is, because hypoxia issue will be there. There is no any way to see when his hypoxia starts and how it ends. Now we know how it ends. Next time I would like to bring another professor here from the oncology hospital.
Great.
Yes, I would like to have him talk next week. János Hunyadi professor from the National Institute of Oncology Hospital. He's a dermatologist and he's a PhD.
Yes.
And he's a scientific guru on all this. And
highly respected
yes,
scientist.
and I have a great deal to learn from him. And I was very, very happy to convince him to come to my shows. And I bring you more and more people day by day who is somehow connected to hypoxic issues. I thank you very much for all of you who had spent the time with us today. And thank you very much. And next week I see you. I hope we're going to be much more. Please spread the word. Okay? You have hypoxic issues where we can bring into normoxic issues. Good night, everybody. And thank you very much for coming to see us. Thank you, Attila.
Thank you.